Good afternoon, everybody. Welcome to today's webinar, which we are going to be covering pregnancy and cancer, myth busting and support through treatment with digital tools. So you will be hearing from Lucy Landau, who received a cancer diagnosis back in 2016 when pregnant with her second child, and also Paul Landau, who, after supporting Lucy through her treatment, built Careology to enhance the delivery of care. So just a few housekeeping rules to begin with. We are recording today's webinar for those who couldn't make it, and it will be sent around in case people need to drop off the call. We do have a Q&A box, which you should see with a little bubble that says Q&A. Please do drop any questions you've got in there. And when we get towards the end of the webinar, we will be covering any of those questions off with you all. Afterwards, Careology will email everyone. And if you wish to get in touch or have further questions, you will have their details to get in touch with Careology. And the recording will also be shared on YouTube to watch back and raise awareness for this important and challenging topic that we are covering today. So I'm Nat Bingham. I'm going to be chairing the webinar today. And I also have Paul Landau and Lucy Landau with me. So Paul, would you like to introduce yourself to the delegates?
Yeah, hi Nat. Hi, thanks very much. So I'm Paul Landau. I'm the chief executive of a company called Careology, which, as Natalie said, I started after Lucy's diagnosis and treatment, which we'll dive into today. So I look forward to kind of bringing that to life for you a little bit. And thank you everyone for attending. I hope you find it a really interesting session.
Thanks, Paul. And Lucy, would you like to introduce yourself?
Hi, I'm Paul's wife, Lucy, and I'm just going to talk to you a little bit about my journey with my diagnosis and treatment today.
Thank you, Lucy. Thank you so much for, joining and talking about this topic. Can you talk to us about how you felt after your diagnosis back in 2016 and how day-to-day life was?
Thank you. So I was initially diagnosed when I was about 36 weeks pregnant. I'd not been feeling great prior to my pregnancy and sort of had that slightly investigated, but it was sort of dismissed as being tired as a new mum and losing my end of my baby weight sort of quite quickly. And then once I'd fallen pregnant again with my second child, all those symptoms for the lymphoma were dismissed as part of the pregnancy. So it was masking everything. And, the night sweats, itchy skin, all kind of fell under, well, you're pregnant. And it was only really when I got a lump that I thought, oh, that's not quite right. And I remember sort of speaking to my sister and she was saying, oh, lumps and bumps are normal in pregnancy, you get ingrown hairs or this or that, whatever. So on my 36-week checkup, when I was speaking to the nurse, I showed her the lump and instantly she obviously knew that something wasn't quite right and said, you need to go and see a doctor straight away. So quite promptly the next morning, I booked an appointment. I'd actually attended without Paul. And almost immediately he had told me, I think this is lymphoma and you need to go and see an oncologist, at which point sort of life took on a whole new dimension. I remember calling Paul and sort of just being so overwhelmed that I was like, what's an oncologist? Why are they saying this? What's happening? And Paul rushing down immediately to join me. And it was a very surreal moment in time. I was sitting there with one hand on my pregnant tummy and, sitting in a room with my consultant being told that the baby had to come out pretty quick and I had to start treatment almost straight away. So I was faced with a number of different decisions that I had to give very quick answers to. So before I'd even had the baby, we were talking about, would I want to have any further pregnancies? Did I need to harvest eggs? How that would impact on my treatment and when that was going to start. I was quite thankful at the time that I was nearing the end of my pregnancy. So my daughter was already fully formed. But I had to have injections to ripen her lungs so she was able to come out early. And then I think it threw up so many uncertainties, so many unanswered questions that Paul and I needed answers to pretty quickly in order to make life-changing decisions. And I think at the forefront of my mind was the health of my baby, over and above myself at that point. Was she going to be okay being delivered early? Had me being pregnant whilst having cancer affected her? Was her development affected? And it was very hard to find the answers to those questions. Paul and I sat together, sort of reaching out to doctors that we knew who were looking at random case studies or evidence to try and reassure us. And we didn't really have anybody to answer those questions. My consultant had only dealt with one other patient that was diagnosed with cancer during her pregnancy, and he sort of said, oh, I'll ask her if she wouldn't mind getting in touch. But that was pretty much it in terms of finding somebody else that had stood in my shoes.
And what about, did you have any CNS input to help take you through that journey at that very initial diagnosis stage?
So very quickly, Paul and I were introduced to the CNS team, and they were absolutely vital. They became our first line of support and answered everything from anything, every rash that I had, every question that popped in my mind. You know, was I going to be able to pick up my son from nursery? Was it okay for him to, I had a toddler as well. Was it okay for him to be attending nursery, being exposed to the germs? When my daughter needed to have her inoculations, could she have all of them? Because some of the inoculations were live. So all these questions that I didn't know where to turn, they became my first port of call. And I think, Paul, you can agree that in the early days, I think there'll be multiple calls a day trying to answer some of these questions that we needed the answers to fairly quickly. When you've got kids and you know, answers don't wait, so time's always moving, so we needed to know pretty quickly. And life took on a whole new dimension, and it was rolling without me. The appointments were happening, everything was scheduled, and I had totally lost control of everything, even down to the care of my children. Having a new baby and starting cancer treatment at the same time, you know, we had to make decisions about, obviously I wasn't going to breastfeed, so bottle feeding, which had been a change from my first child. When I had my PICC line fitted, I remember the CNS nurse talking to me in depth, because I had tried to resist it a lot. I wanted to be able to pick up the kids and hold the kids and bottle feed. And actually, in the end, it was by them sitting very patiently with me and talking through like the benefits of the PICC line and how it would actually help with my treatment and speed up my hospital appointments. That we decided that my PICC line would be fitted in my other arm so I could still hold my baby and bottle feed her. So if I hadn't had that gentle hand and support, I probably wouldn't have even had that fitted, which was absolutely imperative to my treatment. So yeah, the CNSs were incredible, and I couldn't have done it without them.
And you've mentioned a lot around, there was numerous calls, there was numerous paper, and also touched upon having a toddler, but then becoming a mum again, second child, and how completely different that looked to maybe the first time you became a mum. Bearing in mind that treatment for nurses and patients was totally pen and paper, so lots of different information leaflets, numerous calls, as you said, where you felt as though you needed an answer pretty swiftly. How did you manage your diagnosis alongside pregnancy and being a mum?
I think lots of notebooks. So with chemo brain and baby brain, I could barely remember anything. So particularly with things like taking my pills, I think Paul helped me do a spreadsheet initially, and then every Sunday night we would sit there putting all the pills into the pill boxes. And then I had loads of different alarms on my phone to help me remind me, to take the pills or to feed the baby, or scheduling all sorts of things, being able to do handovers for all sorts of different people that were looking after the kids. I'd be given sort of printouts of my next chemo regime and the side effects, and it was really a sort of a case of what I could manage at the time and what was the most important thing to be dealing with at that moment. So I'd have a diary going of my chemo symptoms. I think I had to ask the CNS to help me liaise with the nursery if anybody had brought in any, bugs, to let me know immediately. So that transparency with the nursery and the parent community. So I think it was relying on the support of the CNS team, but also kind of reaching out to the wider community, and having to ask for help and being open to receiving it. From the little things like people coming round and cooking meals for us, when I was in hospital, for sort of days at a time with some of my chemo treatment, but also to help Paul, who was then picking up the care of my newborn baby and a toddler whilst trying to visit me in hospital and deal with everything that I was going through. So as well as sort of the physical impacts of the cancer diagnosis, there was huge repercussions with the psychological impact. And I think, as a mum, mum guilt is there on every level, but I had new levels of mum guilt, of not being there for the baby, of not being there for the toddler. So anything that I could do to try and ease that, I needed to do. But yeah, keeping track of things was incredibly difficult. So writing everything down was my first port of call.
And it sounds as though there was a lot to juggle, a lot of coordinating to do. And there is at the moment a lot of talk about empowering patients to self-serve, particularly in the NHS long-term plan. So would you say that shifting some of the onus of treatment onto patients does or would help them to feel more in control of their diagnosis? Did that coordination, did everything that you was having to juggle help you feel more in control?
I felt very overwhelmed. I think when I was diagnosed, I didn't know anybody else my age that had been diagnosed. I was 36 at the time. I didn't know any young mums, or certainly anybody that was pregnant at the time. So I felt very isolated and very alone. And I think I'd lost all control. So I didn't have any autonomy in doing anything. So if I'd had a little bit more knowledge and support to help me guide through that very challenging time, it would have been really helpful to know what others had done, to be connected, to be supported, to feel heard. So a community would have really helped at that point. Paul, did you want to say anything?
No, I was just going to add on the self-serve bit. One of the things that the nursing team at LPCH did help us do was they taught me to do your GCSF injections. And I don't know whether that's normal and everyone would kind of be taught to do it themselves or not naturally, but I had certainly never administered an injection before, albeit they're fairly simple these days with the nice springy injections that kind of do half the work for you. But that was quite daunting. But it was a really good example of where if we hadn't been able to do that ourselves and self-serve, it would have been yet another appointment to have to go back into hospital for, which obviously for every appointment, it's a journey in, it's time spent in a waiting room, it's waiting for someone to be free, it's the journey home. And as the picture Lucy's painted, I think very clearly, that with a newborn baby and a toddler at home, there was just so much. So any way to kind of enable certainly us as a family to have to just have a little bit less medical attention and less prodding and poking and appointments to get to, I think was welcome.
Yeah, I reiterate what you're saying there, Paul. I think, you know, I didn't want to leave the home. I didn't want to be away from the kids. And every time I went into hospital, it was hours away from them, waiting for treatment or the chemo to be ordered, or even if I had something unknown or maybe an underlying infection, when we weren't sure whether we should go in, I just didn't want to take any time away from being at home with the kids. So yeah, not having to do those extra journeys would have been really helpful.
Yeah, and I think that time with the children is so important, especially with everything that you're going through as a family. What do your children remember? How did you help sort of take them on that journey with you as well?
So I think initially, the first time I was diagnosed, obviously the baby we weren't talking to her, but my toddler, we tried to sort of tell him as much as we could. And a little bit like the nurses would drip feed me information, we would sort of tell them. When I unfortunately relapsed, my son was 5 and then my daughter was 3. So I think we had quite an open dialogue with them that mummy had poorly blood. And, you know, trying to make it age appropriate and giving them the right language to be able to speak about it. So they weren't scared of seeing me with a chemo drip in or the PICC line in my arm, just making it more normal for them. You know, I remember when I told my daughter, and she was only 3, and she said, well, mummy, what if the doctors can't make your blood better? So knowing what to say to her at that moment, I think Paul and I searched online to try and find a storybook that dealt with mothers losing their hair. And do you remember, Paul, we could only find this terrible book that was,
It was so bad.
It was very scary.
Very
And
well.
it was about a rabbit that lost its hair. I mean, it was just not age appropriate or soothing for the children at all. So, you know, we opted out of that. When I'd had my stem cell, I used to send the kids postcards. So they would feel special that something was arriving in the post when I wasn't actually physically there. And we'd sort of try to timetable FaceTimes. And prior to this call, I asked the kids what they remember, which, you know, thankfully, they mainly remember the sweetie cupboard that I had in my room. And they do remember those postcards. And yeah, I think, you know, sort of having that running dialogue with the children so they're not scared to talk about it, but also helped me be able to be more open and honest. And whilst we held things back that weren't age appropriate, being open with them did help. And it wasn't a secret. And still to this day, when I talk about checkups and things, we have that running dialogue. So it's not new and scary to them. Which was quite a different approach than a lot of people at that time went down, because people often don't want to tell their kids what's going on. But, you know, we didn't know what the outcome was going to be. And I needed to protect them and their own mental health as they go through life.
Yeah. And Paul, how did the experience of helping Lucy to manage her treatment push you to founding Careology?
Well, it's you know, even listening to Lucy now, it really just brings back just how much there was to manage. You know, I think again, Lucy's pretty eloquently set out that kind of shock and awe stage at the beginning, just kind of trying to come to terms with what you've just heard, which as a 35-year-old pregnant woman who'd been to see her GP numerous times about itchy skin and night sweats and being told, oh, it's probably nothing, it's just side effects of pregnancy. There was just so much to get our own heads around, and as Lucy said, educating the kids. So I was just struck as Lucy got into her treatment, certainly not at the outset, by how much there was to manage, how much paper was involved, how many appointments there were to schedule. It just seemed, as Lucy said, like a constant flow of just stuff to keep on top of. And my background had been in health tech. I've worked in the health tech space for 15 years previously. And it just struck me what a huge opportunity there was to better support people going through a similar journey to the one that we went through. And obviously there are millions of people a year around the world, but was it close to 400,000 people a year in the UK newly diagnosed? And I think for me, what really struck me was how cancer is almost the inverse of most other health conditions you can think of, in that you actually go into hospital when you're generally quite well, because as everyone on this call knows, you go in for your chemotherapy when you're well enough to tolerate the next cycle. So you've got through your down days, and hopefully you're on that upward trend. You go back into hospital, you have your chemo, but it's actually when you go home that you're having to contend with all of those nasty toxicities from treatment. And that was what really helped me kind of see the opportunity for a tool that could help somebody whilst at home feel just more confident, more secure, more safe, really make the right decisions, or know that they are making the right decisions as they're going through treatment, know when they should be picking up the phone and letting the hospital team know that there's an issue that might be bubbling away. So that really was the genesis to the idea, was how could I build something that could better support that person, but also connect that person back to the hospital team. So the nurses, the doctors, the consultants aren't always having to be working reactively and often firefighting, certainly when you guys find out about side effects that you kind of wish you'd known about a little bit earlier, which would have allowed you to get on top of things and nip things in the bud before they become more advanced. So that was where the initial kind of idea came from.
And I think when Lucy mentioned around a spreadsheet for all of the medication, that is so key. So many people have such a huge amount of medication. Often nurses will scribble on the box when to take it, what time is best. And obviously, Careology, being a patient-facing app, has the medication adherence section. Lucy, how beneficial would you have found if Careology was something that you used in your first diagnosis?
Oh, it would have been absolutely imperative. I think sort of with chemo brain and baby brain, I didn't know where I was coming or going. And I'd often say to Paul, did I just take that pill? Have I taken that? And he'd be like, I don't know. Did you take it? Did you tick it off? I'm like, oh, I didn't tick it off. Did I tick it off? And so we sort of go in this circle of, had I done this? Had I done that? And I think sort of sometimes if you aren't going in between, chemo, and then I'd have my meetings with the consultant, and he'd say, well, how have you been over the last few weeks? And I genuinely couldn't remember what had happened sort of last week, or what rash had flared up just after the chemo, and Paul would sort of sit there prompting me, and we'd have written things down, and he'd look back and at the date, and that side of things of actually just helping me remember what I'd gone through, and know what I was meant to do next. Often it's the next steps that you're also unsure about, and that expectation of what's coming, and writing down things that, as Paul said, with the injections that we discovered along the way, of tips that actually, one nurse has said, if you had a bath first, it's easier then to give the injection, because the muscles are warmed up, and all little things like that, these nuggets of information that we'd be randomly writing down, would all be in one place, and it will all be accessible and in an ordered way to look at things. So I think it's partly bringing a little bit more order and more structure into a very overwhelming time where you're receiving lots of pockets of information and your friends are trying to pass on tips, and somebody's heard from somebody else that had cancer has told you that if you do this, and there's a lot of strange tips that you're given that you don't know if are true, and then you pick up the phone to your nurse and you say, oh, can I take this supplement, or should I do this, or someone told me if I have this diet, when I was immunosuppressed, and all those foods that I shouldn't be eating and things to be eaten, but I didn't know, sometimes I think we took it to the absolute extreme, didn't we, Paul, of not having any vegetables with skins on. But if I'd have known that I could have cooked them, it could have been fine. Those sorts of things that you don't know until you're living it and you're breathing it. And suddenly you're on this very steep learning curve where you're picking up all these things at one point, and it's very overwhelming. So if that was there in an organised forum for you, it would have been immensely helpful.
Yeah, and also the resources section, you've spoken about you had to Google for support for how to take your children on that journey and what story to tell them, and there was a terrible book. But within the resources section of Careology, you would have had that information at your fingertips. So, Paul, the pre-launch phase of Careology, Lucy was involved in that, wasn't she?
Yeah, so it was really after Lucy had successfully completed treatment and went into remission for the first time that I had this idea for Careology that was kind of rattling around in the back of my head. And I started doing lots of research and seeing what else was out there. And as I said before, I was really surprised at how little did exist to support patients going through a cancer pathway using digital technology. And my first port of call actually was I went back and just kind of mocked up some ideas, really back of an envelope kind of concepts, and went and spoke to the two CNSs at UCLH that we'd got to know pretty well, Darren and Emma. And they immediately went, oh, this is actually really interesting. And I think what really kind of helped solidify my thinking was almost getting a sense from them as nurses, almost a sense of frustration. I mentioned before that they said, fortunately doesn't happen too often, but sometimes you will lose patients to things like neutropenic sepsis, which I really picked up on how upsetting and how frustrating that is, because if they had known about it a couple of hours earlier, or someone hadn't taken 2 paracetamol and masked an infection that then quickly deteriorated, and what a huge opportunity there was, not just to support the patient, but to also support the clinical team through using really powerful digital tools. And so, the whole idea started off with symptom tracking, and we actually started by looking at a Bluetooth thermometer that you could wear 24/7, and it would seamlessly upload your temperature throughout the day, especially during your high-risk days, was the idea. So that if your temperature even started trending upwards, Careology would be able to inform, say, an acute oncology service. So someone could proactively get in touch with a patient and say, we'd like to come in to get a swab done or check you over. So it's been a very gradual process over the last 5 years, starting off with really symptom tracking, and then, as you both talked about a few minutes ago, medication management, because clearly that was a really big pain point that I witnessed firsthand. And there were so many examples of when I would kind of come down to the kitchen in the morning and Lucy would be sitting there with packets of pills over the kitchen table saying, I can't remember if I just took them or not. And then, as Lucy again has mentioned, the treatment journal that she kept pretty religiously. So when she went in for consultations, she could kind of have a more accurate picture to be able to report back of what she had experienced. So I guess to start with, Careology started with trying to find user-friendly digital solutions to really help address some of the real-life issues that we had faced as a family. But over the last couple of years, obviously almost every different tumor type or diagnosis has different things you might need to manage, different information that you need to access. So, you know, with the help and input from lots of the partners we've worked with over the last certainly 3 or 4 years, as Careology has really started to get into the marketplace, we've continued to learn and iterate and build out the product. And it's really grown with so much input from other patients who have gone through obviously very similar life-changing experience as Lucy did, but also people like you, Nat, with your LPCH hat on, the team at Guy's and St Thomas's, we have a great relationship with, the team at Nuffield Health, you know, our relationship with Macmillan. So just over time, we continue to keep evolving and listen to what are the challenges that all those user groups, whether they be patients, caregivers, so the shoes that I was wearing, and the clinical teams, as well as identified as areas where digital could help ease some of the burden on everyone as individuals, but also the healthcare system at large, which doesn't need me to say, we all know is incredibly stretched and short of resources. So really starting to look at how digital tools can help cancer centres, departments work more efficiently and effectively as well. So we're really seeing huge opportunity for how we can use Careology to make a real impact on cancer care.
Yeah, certainly. And what would you say to the nurses here today who might be interested in bringing technology on board at their trust? Because you've just named quite a few who are already, you know, coming forward with that.
Look, I hope that we are now really starting to demonstrate the real impacts that Careology is having on all those different stakeholders I've just mentioned. I think it helps your patients manage the day-to-day of a diagnosis, really with tools that help them feel far more confident. And I would say that patients these days, you know, patients aren't patients, they're people. And we're all consumers and we all use technology in every area of our lives, really. So having great technology that can help everybody, you know, juggle all of the things that need juggling, I think has so much opportunity for your patients. But I think for you guys as healthcare professionals, I really don't think you need to be afraid of technology. Certainly at Careology, we've spent a huge amount of time really trying to create a system which is easy for everyone to use and really helps you do your job better and more efficiently as well. So if you're interested in Careology and the opportunity to use digital tools, please do let us know. We'd love to kind of bring everything we've talked about today to life and show you the value add that it can deliver.
Thanks, Paul. And so bringing this back to a group who really do need that extra layer of support, where have mums traditionally found support through their treatment, do you feel, Lucy?
I think that's a really good question. As I mentioned, it was very isolating, and I, at that time, didn't know of any other mums, young mums that were experiencing or had experienced the same thing that I was going through, a cancer diagnosis as a young mum or as a pregnant mum, was unheard of. So I think, you know, it's just word of mouth. Sort of when I was initially diagnosed, social media wasn't as prevalent as it is today. So it was, you know, one person saying, oh, I know somebody, why don't you give them a call? And even today, I'm often asked, oh, I know somebody, they've got a type of cancer. It's nothing like the cancer that I had, but do you think that you could speak to them and just let them know what you experience or what might be helpful? So it's creating like a little community. And I think if I'd have been able to connect more easily with other mums or other young adults that had been through the same thing at that point, I would have felt more heard and more understood. And sometimes it's just a case of actually connecting with those people and sharing those experiences. And there'll be little, you know, nuggets of information that we'll pass on to each other. I'll say, oh, I did this or I did that, or it might be really handy to do this. I think today there is a lot more on social media, and I've seen particularly post-COVID people telling their stories online, and that just helps create that more of that community. But not everybody is comfortable with putting themselves out there and so having everything online. So actually being able to connect in a forum where you're a little bit more anonymous would be great, because not everybody is prepared to put themselves out there and be seen. But it's really important to connect with other like-minded individuals that understand what you're going through. So it moves just past word of mouth or a friend knowing a friend. And actually there is a network of people that can support you.
Yeah, that's really interesting, Lucy, what you touch upon there. Paul, do you think digital has a key part to play here?
Yeah, I think it definitely does. And just picking up on what Lucy was talking about just now, Lucy, it might be interesting to talk about how other people reacted to your diagnosis, because in answering that question, the way that we've tried to build the brand is to try and make it more approachable, and just how you used to talk about cancer head.
Yeah, I think most people didn't know, and still when I talk about you know, my journey, don't know what to say to me. Most people we sort of joked saying would sort of give me the side head tilt, and you know, sort of look unknowingly and just nod. I'd have people that wouldn't say anything at all and pretend that everything was absolutely fine. And then the people that would say untold amounts of ridiculous things because they didn't know how to deal with me. I think as a woman, most people just assumed that I'd had breast cancer. So that assumption of, you know, only a woman could have this, and putting you in a box. So there's a lot of unshared information and people don't know how to approach it. Now, if people sort of ask me, I say, well, you know, just be honest, just say something, because not saying anything makes a person feel worse. And it's all part of that being heard and being validated, that makes somebody feel supported. So I think the initial way of was, you know, people pretending it wasn't happening. And I think, you know, that largely sort of dates back to sort of how people used to deal with cancer, that it wasn't something spoken about, that you didn't talk about what you were going through or your symptoms, and you struggled in silence. And now people are more ready to share their stories, to be heard, and allow people to be helped through a supportive community of each other, as well as the whole medical team that is definitely holding you up behind the scenes, that you wouldn't be able to get through unless you had them. So opening those doors and those channels of communication is really important.
Yeah, so that's exactly. I remember you used to get so frustrated that you'd bump into people that you know quite well who just I don't, it's not a fault thing. I think people just really didn't know what to say. I think people were so just upset for you in a lot of the time. You know, they didn't know any other people who'd been through pregnancy whilst pregnant, so a cancer treatment whilst pregnant with a young baby at home. And people would often just not know what to say, so would say nothing. But as you're saying, that was almost kind of worse for you.
Yeah. Or I'd end up supporting them because they'd be teary and upset, and I'd be the one that was, you know, helping them.
Yeah. And so Nat, bring that back to the question you asked me. I felt really passionately when I started Careology that the way that we built the technology really had to be designed and delivered in a way that was like any other technology you would use as part of your everyday life. It didn't have to be kind of dry and boring and risk being stigmatizing in terms of the brand and the tone of voice and the colors that we use and the imagery that we use. And I really wanted to create something that was just for people, for consumers, for the same person that you were before your diagnosis, because you may be going through a really difficult time. You may have lost your hair. You may be juggling an awful lot of challenges. But I don't think anyone going through cancer treatment really wants to be treated, in any other way than the person they were before. That may not be factually correct, but I think that's probably right. So we really wanted to create something that just felt really approachable and engaging, and really could help somebody address the day-to-day. Going back half an hour in the conversation to all of the things that Lucy and everyone else going through a cancer diagnosis has to manage on a daily basis. It was really important to me that we created something that just felt engaging and approachable, but was truly useful and truly understood the challenges that somebody faces on a daily basis.
And I think that's so important, and it has me thinking around. Lucy, you mentioned, people didn't often know what to say to you, and I do think sometimes that comes from a fear of saying the wrong thing, or not really understanding if it's something you want to discuss. But obviously throughout Careology, you have the option to share updates with friends and family, and maybe that would open doors for people to have, openly have that conversation with you, Lucy, and not be so afraid to sort of just nod along so that you still feel heard. So thank you both. So my last question is, how have you seen cancer care changing from Lucy's first diagnosis in 2016 to now? And also, where do you think it will be in the next 10 years? Because we've come so far in the past 10 years. Paul, I don't know if you want to pick that up first.
Yeah, I'm happy to. I think certainly, going back to when Lucy was first diagnosed or first went through treatment throughout 2016, there was literally nothing available to support her. There were a few medication tracking apps available, but there was really nothing that kind of was designed for cancer care that helped somebody across all of the different things that needed managing. And I think there's no doubt, certainly over the last 2, 3, 4 years, that the sector, excuse me, the sector for digital cancer care really has started to emerge really strongly. And there's some great technology out there, and I'm really proud that I think Careology has been leading the way in terms of creating the sorts of tools that we've been talking about. And I think, I often compare healthcare to a little bit like the banking sector, whereas you only have to look back 5 years ago, 5 to 10 years ago, and we all used to go to bank branches kind of all of the time to pay money in, take money out. If you wanted a loan, you'd have to sit down and talk to somebody, where today you do so much more digitally. It's very rare. I mean, half the bank branches in the UK have disappeared. So it really shows how an industry which is also traditionally very conservative has been able to adopt and deploy technology in a way that has made people's lives easier. And I'm not suggesting for a minute that you'll probably get the same extent within cancer care within hospitals, but I think we're definitely seeing, you talked about self-management, empowering patients to understand more for themselves. There's been a huge movement now towards looking at how digital can better support patients and clinical teams. COVID was definitely a big catalyst in terms of, video consultations started happening, overnight. And I think that really helped overcome a lot of the challenges for acceptance of technology in healthcare. And I think that really has helped kind of open people's minds to how technology can be used. So it's moving very quickly now, and we're really seeing digital being adopted very fast. If we were to look another 5 years down the track, goodness, I mean, clearly the big area that's being talked about in every industry today is AI. Fortunately, I don't think that we're sitting here looking at how AI is going to replace doctors and nurses. But I think there are huge opportunities for how AI can help better prioritize, predict, personalize healthcare, and I think really use AI to provide clinical teams with tools to really help optimize how you look after your patients and really drive more efficiencies in a healthcare system, which, as I mentioned before, clearly we all know is under an immense pressure and incredibly stretched. So digital really has huge opportunity for really helping address a lot of the challenges that are faced today by all the players in a cancer pathway.
Thank you, Paul. We do have some brilliant questions from the audience, so thank you for the questions that you've popped in so far. So I think this one open to either of you, but what kind of support might have helped to reduce the psychological impact of your diagnosis and treatment? So probably for Lucy, that one, I would imagine.
It's a big question. What sort of support would help? I think just someone being able to answer those questions, to point me in the right direction without giving me wrong information. There's a lot of information out there. I think one of the things I was told was not to Google, that I could only use the Macmillan website and nothing else to find out information. So being sent in the right avenues to receive the correct information, and also on that sort of need-to-know basis, which I think the CNS nurses were incredible at, sort of that drip feed of only telling me what I needed to know along the way, but also quietening down that voice at the back of my head of all those unanswered questions or things that I was thinking of late at night when there was no one else to speak to, and I would reach to Google. Yeah, connecting me with the right professionals at the right point. So when I wanted to know about the baby's health or, you know, what was going to happen if, lots of those if questions that are really important to help ease a patient's uncertainties. Paul, did you want to say anything?
No, I think, you know, right information at the right time. Was the thing that was really top of my mind. And I, you know, again, you talked about it earlier on, lots of paper, lots of booklets that you would pick up, either were printed out and given to you, or you picked up pamphlets, you know, the Macmillan pamphlets from the rack in the waiting room. But really what happens in reality is those end up in your bedside drawer.
Yeah.
And actually when you need them, it's like, where the hell did I put that booklet? I know I've got it somewhere.
Yeah, searching for the right thing at the right time.
So being able to get that information, I think, is absolutely key.
I also think, sorry, Paul, I was just going to say that I think what was largely unspoken about was the mental health impact of, you know, we talked a lot about like the psychological, the physical side effects of chemo and, you know, how to manage those sorts of things. But what wasn't spoke about was my fears, my feelings, you know, the unanswerable questions, the questions you don't want to ask. So that side of thing, and carrying all of that weight, which often, you know, I wouldn't want to always share with my family or with my friends, because sometimes just opening up and putting it out there made it very real. So someone opening those conversations to me and discussing those things that I didn't want to talk about and making it okay to talk about those things in that safe and held space would have really helped the psychological impact that I had to deal with. And, you know, offering those services to talk to people is really important and somewhat overlooked at that point.
Yeah. And another question from one of the delegates. Did you ever worry you were overburdening the clinical teams or contacting them unnecessarily?
Yes. As I said, right at the start, we were having multiple phone calls a day. And then sort of as you go into it and you think you begin to know what's going on, but you're not really sure. And then something unexpected would happen. And Paul would say, oh, why don't you drop them a call? Why don't you call them? And I'd be like, no, it's fine. I'm going to wait a few hours. I'll see if it goes down, or, you know, I begin to feel better. and I'd have my parents on the phone. Have you spoken to your nurse? Yeah, have you spoken to your nurse? Or I'd call and leave a voicemail and be waiting for somebody to get back to me. And then I think, was it important? Should I have asked that question? So definitely, yeah, I think we always had questions, and Paul and I would go into any meeting that we had with either the CNS nurse or my consultant with a whole list of questions that we would want to get through. Yeah.
It was almost, and yes, I don't want it to sound like we're kind of we're on the phone day in, day out, because it wasn't quite like that. But it's almost the inverse, that you don't want to be a nuisance. And I think that's also where some of the risks creep in, because, you know, Lucy, you know, I remember being explained to us what neutropenia was, which, you know, we'd never heard of that before. And I remember you woke up, I think it was after your second or third cycle of treatment, with a temperature. And we spent about 20 minutes going, did they really say that we need to get in touch if I have a fever? And fortunately, in the end, you did pick up the phone, and they did ask you to come in, and you did have an infection. So we did pick up the phone eventually. But yeah, it's that not wanting to bother people who, you know, are busy and time constrained as well. Can often mean you're not picking up the phone. So it's really hard at times to know when is the right time to get in touch and when to.
And I'm guessing if you said that to any of the nurses on this call, they would be saying, just ring, just phone, it's fine. So we do have a question specifically for Lucy. Somebody has said, thank you for sharing your story. Had you heard of the charity Mummy's Star, which specifically support women affected by cancer in pregnancy and 12 months after giving birth?
I had heard of that charity, and I think at that point they're based up north, so I wasn't in their local vicinities. They actually couldn't at that point support or help me, and they were much smaller than I believe that they are today. So within their remit, they offered a little bit of support, but they couldn't really support me being in London, and they were a small charity at that point. So yes, I had heard of them, but also I think when I sort of looked into it, it was a charity that the mum set up in memory of the mum. So that was sort of a place I didn't quite want to go to as well. So unfortunately, they just weren't able to help support me at that point.
That's a really interesting point, Lucy, what you mentioned, because you know, you strayed away from it because you didn't want to go down that route of the reason for the charity set up. I think that's key for nurses to understand, you know, what charities to point people in the direction of, and considerations to keep in the back of our minds as nursing professionals. So thank you for sharing that. Lucy and Paul, I don't know if you've got any take homes that you want to share with the participants today?
I hope it's been a really useful hour. For me, it's brought back a lot, actually, just listening to Lucy talk about a lot of the stuff that she went through as she was going through treatment. And I think also just a huge thank you to Lucy. I know when she finished treatment, she was very keen to really start talking a lot more about this topic of cancer in pregnancy. It's such an often not spoken about area. And it really is so important. So a big thank you to you, Lucy, as well. And this August, she'll be 5 years in remission, so it's a big milestone coming up as well.
Big milestone. Thank you both so much for being so open and honest.
And I just wanted to sort of close with saying, you know, by sharing our story and, you know, Paul creating Careology, anything that we can do that people can benefit from, you know, is of comfort to us, but also knowing, you know, that our journey can help other people. It's really important to me personally.
Thank you to everyone who has attended. Please let us know how you felt about the session. Any feedback, please send on to UKONS. As I mentioned, Careology will be in contact over email, but if you would like to reach out directly, you can DM Paul on LinkedIn or contact add a message to the contact page on Careology website, goes directly to the team on this call, and they will be in touch. So thank you to Lucy and Paul again. Really, really appreciate it. And I hope everybody has a good day.